The first thing I would do is an environment scan. This is for the video, but I would do it in real life in a patient's room too to make sure that there's no safety hazards anywhere. I would have gathered up my supplies before I came in here. And the next thing I'm going to do is perform hand hygiene, and I would provide privacy. Then I would introduce myself and explain what I'm doing. So my name is Shauna. I'm going to do a head to toe assessment on you, and that's a basic overview of the body. Can you tell me your name and your date of birth?
Samantha Kellogg, 3/20/1991.
Okay. So after she tells me that, I'm going to go ahead and start on vitals. Her temperature should be between 97 and 99 degrees. Her respiration should be between 12 and 20, and they shouldn't be too deep or too shallow for the situation. Her oxygen level should be between 95 and 100%. Her pulse should be between 60 and 100 beats a minute. And for her blood pressure, the systolic should be anywhere between 95 and 140, and the diastolic should be between 60 and 90. Now, I'd also want to find out her pain level, and I would do that using a 0 to 10 scale. So, on a level of 0 to 10, with 0 being nothing at all and 10 being the most you've ever felt, what's your pain level?
0.
Okay. So, her pain level is a 0, but if she did have pain, then I would need to find out the characteristic, the severity, the duration, whether or not it radiates, the location, and if there's any relief factors. So, the next thing I'm going to do is I'm going to be working on figuring out her mental status or her level of consciousness. She is oriented to self because she was able to tell me her identifiers. So I want to find out a few more things. Can you tell me the date and who's the president?
April 21st, 2022, and Joe Biden.
Okay, and do you know where we are and what the situation is?
We are at my house, and you were doing a head-to-toe assessment on me.
Okay, so by this we know that she's oriented to self, place, time, situation. She is awake, alert, and responsive, and as far as her mood, behavior, and affect, she is cooperative and appropriate for the situation. So during this entire assessment, I'll be looking over her skin and making sure it's okay. I'm going to check temperature, color, see if there's any moisture or edema. I'm looking for any kind of wounds or lesions. I'm going to look for wounds and drains, or any kind of invasive lines like IV lines. I'm looking over the Braden scale. The max is 23, but anything less than 18 does put her at a higher risk for pressure ulcers. So, are you having any difficulty hearing me?
No.
Okay, I don't see any assistive devices for that. Another way I could check her hearing is by standing just right behind her on the side and quietly saying a word and having her repeat it back to me, and then do the same on the other side. I'm going to inspect her external structures like her eyelids, her eyes themselves, and the lashes. Check for anything out of the ordinary, and everything looks okay. She's wearing corrective lenses, so she does have an assistive device for vision. Some other things I want to check though are the central nerves 3, 4, and 6, which are the ocular motor, the trochlear, which was the ears, and the abducens. So one of the ways I'm going to do that is by using my pen light to touch her nose, and she'll just have to follow it. So just follow this with your eyes while I touch your nose. Boop. Okay. Now I'm also going to use the star method to check her eyes. So as I move my pen light, just follow it with your eyes without moving your head, okay? Okay. So I'm going to dim the lights because I want to check and make sure that for Perlo, which is making sure that your pupils are equal, round, reactive to light, and accommodating. So if you'll just move your glasses for me. Alright, so. Alright, good to go. So I'm also going to check nerves 9 and 11, which is her glossopharyngeal and her vagus. What I'm going to do, how I'm going to do that is by checking her mouth, lips, teeth, tongue, oral mucosa, and then I'm going to have her say ah, and I'm going to check to make sure the palate raises symmetrically and does as it's supposed to. So go ahead and say ah for me. Alright. I also want to make sure that I check the patency of her nares. How I'm going to do that is by occluding one and having her breathe through the other, and then vice versa. Okay. Alrighty. So now I'm going to move on to her neck. So with the neck, first, this is going to be her accessory nerve. So that's number 11. So I'm going to put pressure on your shoulders, and I just want you to shrug for me. Okay, and now I'm going to place my hand on your cheek and just turn against it. And same on this side. Alright, awesome. Now I'm also going to check her, I'm going to palpate her carotid pulses. So these are right here. What I'm feeling for is the rate, rhythm, and amplitude. The rate should stay between the 60 and 100. And this is with all the pulses that I check throughout this assessment. I want to make sure that they're symmetrical bilaterally. I want to make sure that that rate is still between 60 and 100. And that the rhythm is regular, and that the amplitude is +2 or bounding. So now I'm going to auscultate the carotid pulses with the bell of my stethoscope. And I want to hear very little sounds, if at all, just S1 and S2, but I want to make sure that I don't hear any swishing or bruit, because that could mean that there's turbulent blood flow. Alright. Another thing I'm going to check for is jugular vein distension. To do that, I'm going to have my patient make sure that she's sitting upright of 45 degrees or more. And then I'm just going to inspect the neck here to make sure that's not there. Okay, so I'm going to move on to her upper extremities. The very first thing that I'm going to check is the capillary refill, so I can just see your hands. Alright, what I'm looking for is to make sure that they fill up in less than 3 seconds. So I'm also going to check your range of motion. So if you'll roll your shoulders back and forward, and then let me see you bend your elbows. Okay, and then twirl your wrists, and then kind of up, down. Alright, now I'm going to put my fingers out, and I just want you to squeeze them. Okay, when I do that, I'm checking strength and making sure that that's symmetrical as well. Same with all the ranges of motion. Now, if you'll close your eyes, I'm going to place my hands on your arms, and I just want you to tell me where I'm touching. Okay.
The lower part of my arm. The upper part of my arm.
Okay, and then I just see your radial pulses. Thank you. Those are symmetrical bilaterally, so that is good. Bilaterally. So I'm going to go onto your chest now. So the first thing I'm going to check is the AP diameter and make sure that her chest is twice as wide as it is deep. And that is good. So the next thing that I want to check is the point of maximum impulse, which is the left side of her sternum on the 5th intercostal space, which is her mitral valve. And I'm going to palpate that to make sure that rate, rhythm, and amplitude are correct. All right, so I'm just going to touch right here. Okay, awesome. The next things that I'm going to do are check the 5 areas of the heart. I'm going to auscultate them, and if you could turn just a smidge that way, thank you. I'm going to do this with the diaphragm of my stethoscope. So I'm going to start in the center intercostal space to the right of her sternal border. This is the aortic valve, and here S2 should be louder than S1. Then I'm going to move to the left of her sternal border in the 2nd intercostal space, and this is her pulmonic valve. And once again, S2 should be louder than S1. Okay, I'm going to go to the 3rd intercostal space, right to the left of the sternal border, and this is her Erb's point. S1 and S2 should be equal here. Alright, I'll move to the 4th intercostal space to the left of the sternal border. This is the tricuspid valve, and S1 should be louder than S2. And then I'm going to go back to the mitral valve in the 5th intercostal space, where S1 should also be louder than S2. Good. So, again, I was making sure I didn't want to hear any swishing or bruit or anything abnormal sounding. I just want a clear, good rate, rhythm. Alright, so now I'm going to listen to the 5 lobes of the lungs. While I'm doing this, I'm going to be auscultating and listening for any kind of wheezing, rhonchi, stridor, or crackles. I don't want to hear those. What I want to hear is clear, even, good breath sounds. Okay? I always put them wrong that way. Okay. Again, I'm doing this with the diaphragm. I'm going to listen here. Alright, and if you lift this arm for me, I'll listen on the side. And same over here. Thank you. And then I'm going to listen back here in the posterior. Okay. And that was all clear and good. So I'm going to go on to her abdomen now. The first thing I want to do is inspect and make sure that it is flat and round. Then I'm going to ask you a couple questions. When is your last bowel movement?
This morning.
Okay. And are you having any trouble with urinary incontinence or retention?
No.
Okay. So after making sure that those things are in the clear, then I'm going to want to listen to her bowel sounds. Now, I'm going to listen for 1 minute in each quadrant. And in that minute, I should hear between 5 and 30 bowel sounds. If I didn't hear this, I would need to go back in each quadrant and listen for at least 2 minutes. If not, 5 would be the preferable amount of time to listen. So I'm going to go ahead and auscultate those quadrants now. Okay. I'm going to start with the lower right. I'll go to the upper right, upper left, and lower left. Alright. Now I also want to palpate these areas because what I'm looking for are any masses or any tenderness. And I'm going to go in the same pattern that I did just now. I go lower right, upper left, and lower left. And that's good. No pain or tenderness?
No.
Okay. So I would also at this point check her femoral arteries, and then I can move on to the lower extremities. So once again, I'm going to start with capillary refill first thing. I still want to make sure that it is less than 3 seconds fill. I want to check her pedal pulses, which are about 2/3 of the way up her foot. And again, they should be symmetrical bilaterally. And then I also want to check her posterior tibial pulse that's right here behind her ankle. Those are good. So I'm going to test your strength I'm just going to put my hands right here. If you'll just push up against them. Awesome. Okay, and then if you'll stand up for me, I want to do some range of motion stuff. So just have your foot forward and then back. Roll your ankle around. Okay, and then the same on the other side. Forward, back, and roll your ankle. Alright, you can have a seat. Now, if you'll close your eyes, I'm going to test the sensation again, okay? So,
My outer calves.
Mhm.
And my outer thighs.
okay, perfect. And one thing I did forget to mention that I was checking for earlier whenever I was working on her chest and listening for all that was, even though it's done during the vitals, I'm also checking the depth, making sure that the respirations aren't too deep or too shallow again, since I'm already assessing her lungs and everything at that point. So, I think this concludes my head to toe assessment.